Hello guys, today we'll be doing the presentation for group 2. These are the name of our members. These are the table of contents, introduction, prevention and conclusion. Introduction. Smartphones, as we all know, have a significant role in people's everyday life now. And the number of those roles and the number of phones being used is growing at a very drastic rate. Now, using the smartphone, right, requires, it leads to people being put in awkward position, and that in turn increases risk of musculoskeletal disorders, and that usually leads to a lot of pain. And the most common forms of musculoskeletal disorders are muscle fatigue, or weird pain or feeling of load on the neck and shoulder muscles. This happens due to the repeated motions of hands, wrists, and arm. As a result of this pain, our body becomes stiff and tends to become insensitive to pain, and then this leads to quivers in the neck, shoulders, and arms. Shoulder arm neck syndrome is mainly found in people who do repetitive work for more than 6 months. Previous studies of these disorders have been based on students' use of computers, because various students prefer their computer set at awkward positions, usually not healthy positions. There has been some research carried out on factors related to the visual display terminal syndrome experienced by middle and high school students. However, these days, many students use smartphones for longer periods and more frequently than computers because they are small, easily portable, and accessible. Despite this, there has been little research on the relationship between their use, pain, and posture, or on the effects that smartphone use has on the musculoskeletal structure of each body region. This is prevention. So basically, smartphone overuse can cause wrist pains and sometimes inflammation of tendons, and can sometimes cause strain on muscles too. Sometimes it get worsened to the point of surgery, but if the symptoms are minor, these tips can help alleviate the problem. So the first tip is to do smartphone stretches. Taking breaks from constant phone use is important. While you're taking these breaks, be sure to flex your wrist, hand tendons, and muscles forward then backward to keep them flexible. The second tip is to apply a hot or cold compress. Hot compresses will relax the tendons and muscles around your arm, which will allow for better movement and more mobility and more reach. For acute pain that lasts for about 1 week, a cold compress can help better than heat, because heat may result to swelling and more throbbing pain. The third tip is massage. Massaging your hand can help break up the ball-like muscles and calm muscle spasm. The fourth tip is to give your thumb a rest. The thumb is the most used appendage, this in turn can lead to thumb arthritis, tendinitis, and contractures. To prevent texting thumb, you should alternate using your other fingers for typing on the screen. A stylus pen can also help keep your wrist straight. The fifth tip is that we can also use hands-free features on the phone. Basically, we can use voice-to-text mode for messaging and other activities. This will lead to our hands and wrists being at rest, and this will not cause any postural problems. Conclusion. If you are experiencing hand pain from using smartphones for extended periods of time, Making lifestyle adjustments, including lessening the time you spend on the phone and other handheld gadgets, can save you from years of pain. We understand that in this day and age, it is nearly impossible not to use a smartphone, but you should be spending no more than 5 hours, evenly distributed throughout your day, on your handheld devices. By following the above ways of prevention, you can significantly reduce your pain and lower the possibility of temporary or permanent hand damage. Thank you for your attention.